Good afternoon. My name is Barbara Ann Harkins. I'm a graduate Master's of Public Health and Dietetic intern. Today, I want to discuss something that is very important to me and should be important to everyone, and that is Arizona health education regulation. My plan for this presentation is to discuss national and state regulation. I want to talk about why this is so important, state standards we have for health education, Coconino County in particular, and major takeaways for professionals in this field. So why is this so important? The cost of poor health literacy nationally is estimated to cost us $1.6 to $3.6 trillion a year. Poor health literacy. So, because of the cost, you would think that there should be interventions to teach people to become health literate. What do I mean by that? I mean that people are able to decide healthy behaviors. They're able to apply healthy behaviors. They're able to advocate for their health with medical professionals. However, there's very little data and very little research in this field, especially when it comes to the role of the Department of Education in this situation. So how exactly is this regulated at a national level? From a state level, we know that under the 10th Amendment, each state determines how health education is taught. There is some national support. There's some funding through the CDC, the Department of Health, and the Department of Education, but it is not automatic, especially when we think about current legislation that was passed but is still enacting. For example, No Child Left Behind really made the country and states have to focus on core classes, and health education is not a core class. When it comes to Arizona, neither the Arizona Department of Education or the Arizona Department of Health Services enforce health education in schools. They also don't monitor health education, and the only type of information they collect includes the Youth Risk Behavioral Assessment, which basically gives a teenager a piece of paper or survey. It asks them if they partake in criminal activity or they do certain substances. It is unclear on the amount of truth and reliable data that comes from this. From a legislation standpoint, Arizona Administrative Code requires that students be competent in physical education and health education before promotion. So if they are not competent in these things, you would think that they would not be promoted to high school. Why is it so important that we make sure that students are competent in these important health standards before moving on? It's because we want to teach these essential health education tools before the behaviors are solidified. So right when students are learning about other things, they also need to be learning about how to keep themselves healthy, how to advocate for their health. Right? We don't want to wait to educate them in high school, and later adult years where these situations are already, or where these behaviors are already solidified. Preventative health education needs to prevent and be taught before the individual is enacting in something that is unhealthy and might put them at risk. The school board determines competency for health education. Okay, so the state within itself has left it up to not only the districts, but a lot of individual schools and their school boards determine competency for health education. So it is up to the schools and districts to make sure health education is standard-based and to make sure that they have a qualified teacher that is teaching these things. So for health education, and it is not the same in all states, although there are very similar CDC standards that the CDC has published and that a lot of states use. These are the Arizona standards. They are supposed to be taught in primary school and middle school, but because there's so limited data on whether or not they are actually being taught, and it's not enforced, not regulated, not monitored, we don't really know what's happening with them. You can see how important these standards are. So comprehension of health promotion and disease prevention concepts, analysis of factors affecting health behavior, access to health information, products, and services to enhance health, use of interpersonal communication skills to enhance health, use of decision-making skills to enhance health, use of goal-setting skills to enhance health, ability to practice health-enhancing behaviors, and ability to advocate for health. When I think about the impact that COVID has had on our nation in the last couple of years, it is outstanding to me that these are not closely monitored and regulated. It is essential that we do so. But the state does not provide curriculum or assessments. It's hard to know how to support schools in meeting the standards because a lot of it is unregulated. Schools are so incredibly overwhelmed, and the fact that health education is not a core class, it really, really does slip through the cracks. So this is kind of how it works in Coconino County. We can assume that it might be similar in other counties, although again, it is very, very much up to the school and up to the individual teacher. So in Coconino County, we have several school districts. These school districts fall under CCESA that kind of help them run. But the CCESA does not regulate or work with schools on health education. The districts do not have a set curriculum. Individual schools themselves do not and cannot prioritize health education. Many schools only have a few-day workshop or a year in 9th grade where physical education is taught. Within PE, a lot of times the teachers that are teaching them are a coach of a sport and may or may not focus on health in the classroom, just really focus on like the PE physical education standpoint. Again, it's really up to the individual teachers. And this is true for a lot of types of curriculum, right? As a science teacher, I taught biology and anatomy and physiology. Although I was taught about science standards, I was really the one that was determining the quality of education in my classroom. And it is no different for health education. However, when we think about my job of teaching a student about mitosis and meiosis, which is important, but perhaps not as important and applicable as teaching a student to advocate for their health, to understand their health, and to participate in health behaviors that will prevent them from getting a disease. So an example of some school districts. Again, it was very hard to collect this information. A lot of people did not want to talk to me, especially the superintendents, which I totally get. They are very overwhelmed. And I just hope that we can come to support these teachers in teaching students this so that we can have a healthy community. So in Flagstaff Unified School District, which is the biggest district, decisions are made by health or PE teachers. The curriculum is made by the teacher, and resources needed it's really unclear. This is the same for Page Unified School District. They did a couple years ago try to promote the building of health curriculum that was applicable to the students. However, the teacher left. And we see this a lot, right? Is that, teachers are moving around. The average career for a new teacher starting today is just 3 years because it is so overwhelming and difficult. So we can see, if curriculum is made by the teacher, there's really no ability to know exactly what is being taught and if these standards are met. A lot of the curriculum, again, is being taught in 9th grade, right? So at the beginning of high school, even though it is required that we teach students these standards before promotion to 9th grade. Caveat is a program that we have in Flagstaff, in the county, and it really encourages students to have trade skills. So they have everything from automobiles, or teaching students about automobiles, wood shop, that sort of thing. They also have culinary arts. So whether or not nutrition is being taught in those classes, again, it's up to the culinary arts teacher. It's up to the programs. There are culinary arts programs in 6 schools through Coconino County, thanks to Caveat. Again, it's unclear. It's unclear what types of resources they need. It's unclear if they do use some type of standardized health education program like Spark that's evidence-based. We really don't know where they are. There's no data that is being collected, and so we don't know how to help them. So when I really think about what is so important, this is it. We absolutely need to start teaching and preparing our children better for entry into adulthood. And one of those things is to educate them about their health so that they can advocate and make important decisions for themselves that will impact them in the long run. Yes, it's important to teach them science and math and reading, and all of those things are very important. But this to me is the most applicable situation, and we really are failing our students in this state. I have some other resources if you want to look more into this. I've created a spreadsheet for your contacts and resources. So if you are in a school and you kind of want to know, what type of curriculum is being used to teach health education, who the teacher is, you can access this spreadsheet. You can also update it. Anyone can change it. So if you do want to add to it, please go right ahead and do that. I did find one article that can help support your education in this field, which is over here. So health literacy and health education in schools, collaboration for action. This talks about specific barriers, specific success stories, specific legislation that impacts the situation. I also go more in depth in a report that I made about this, and then this PowerPoint can be found here. Thank you. Again, my name is Barbara Ann. I am about to graduate with my Master's of Public Health and Education, my Master's of Public Health and Nutrition. Although I was a teacher for a couple of years and care very much about this issue. If you do have any questions, please feel free to contact me at the email below at any time. And then here are my citations. Thank you very much.